Hello, my name is Dr. Pedus. I represent the Nigerian Association of Western Australia, and I also happen to be a medical practitioner based at Royal Pet Hospital here in Western Australia. I've been invited by Roots TV to talk a little bit about coronavirus and how this could impact on our community, and to provide some education and information to members of the multicultural community and indeed the Western Australian community here in Perth. As you may know, the coronavirus is a new disease which was discovered late last year. It has spread through the world, and as a result, the World Health Organization has recently classified it as a pandemic, which means there are concurrent community-wide infections across communities throughout the world. Now, in Australia particularly, there are about, as of today, 375 cases of coronavirus. And out of that, about 28 of them are here in Western Australia. Globally, there are about 174,000 cases, and about 6,800 people have succumbed to this infection. In Western Australia, we do not know of any deaths, but Australia-wide, there have been 5 deaths resulting from coronavirus. Now, coronavirus is an infection that does not discriminate whether you're poor or rich, whether you're minority or mainstream. It is an infection that was discovered in Wuhan province in China, and as a result, China is actually, Wuhan province is an epicenter of this infection. However, there are a lot of hotspots around the world, including Italy, Iran, and newly South Korea and America as well, and do not exclude the UK. There are new cases coming out of those areas. Now, what do we do? What is our response? We've been getting a lot of information from the health authorities, from the Department of Health here in Western Australia. And what we've been telling the community is to be vigilant, to be alert and not necessarily alarmed. However, it is a cause for concern that people who are immunocompromised, the very young, the very old, those who have pre-existing conditions, like lung diseases, who have had a transplant or have cancer, they are increasingly at risk. We have to do a number of things. One of the things we have to do is to ensure we maintain some degree of cleanliness. So we preach hand hygiene. Always wash your hands. If you have hand sanitizers at home, use them. If you want to sneeze or cough, please cough into your elbow or into a handkerchief. And we have been preaching social distancing, meaning that we from the African community, we are so used to hugging or shaking hands. We are now preaching that people should, as much as possible, nod, wave, and use other signals to appreciate people within the community. We are also preaching that people in the community should avoid, where possible, places, communities where you have a lot of people gathering. The government is recommending 500, but I know the Center for Disease Control and Prevention in the US is recommending 50 individuals. So we as Africans and multicultural community, we normally gather in churches and mosques and all these areas where there are a lot of people. The recommendation is 1.5 or 1 meter to 1.5 meters distancing, social distancing from people around. These are ways that we can try to minimize the risk of getting these infections. If you are sick, please stay home. If you have minor flu-like symptoms, like a bit of runny nose, a bit of cough, please stay at home and isolate yourself. However, if you have fever, worsening cough, shortness of breath, finding it difficult to breathe, you have body aches and you're increasingly getting worse, please call your doctor. Do not present to the doctor's practice because you may actually indeed have coronavirus and infect other people. Call your doctor and they will provide you direction on where you could possibly go in terms of getting the right diagnosis and the right treatment. But if you're unwell and it's mild, please stay home. This is the message from the government, it's message from health authorities, and I think we should be listening to these individuals. Now, there are people that have asked us whether they should be wearing masks and walk around the town. There is no evidence that wearing masks, if you don't already have coronavirus, is in any way going to prevent you from getting coronavirus. However, those who are known to carry coronavirus, if they have to step out, it is encouraged that they wear masks to avoid transmission to other individuals. So as we have heard, and it's all over the media, this is an evolving disease. It's a pandemic, it's a global concern. We here in Western Australia and through the health authorities are doing our best to contain the spread. Like I said earlier, people who are at risk are those who have pre-existing medical problems, like they have a lot of health problems, heart problems, they have lung problems, they have cancer, they've gone through transplant. So these people are people of concern. So if you're unwell, stay home. That is the message. If you are increasingly unwell, please call your doctor for additional information. And I hope I've been able to provide a little bit of information for the community, and I hope we stay safe and stay coronavirus free. Thank you.